second part of Unit 2C PowerPoint, the prostate cancer piece and the breast cancer piece. So starting with prostate cancer, what we talked about before is it's the most common cancer in men and the second leading cause of cancer deaths in men in the United States. So just reviewing the anatomy of the prostate, you see in the photo here, the prostate in males sits right below the bladder and actually surrounds the urethra. So when you have an enlarged prostate or you have prostate cancer, it compresses that urethra, hence the signs and symptoms that you'll see. Okay, so when looking at assessment of prostate cancer, what you'll likely see is signs and symptoms related to bladder outlet obstruction. So related to what we just said with that urethra being constricted or pressed upon. So signs and symptoms like frequency, urgency, nocturia, hematuria are common. Patients can also have pain with intercourse. Patients can have bone pain, which would be a late sign or symptom as a sign of metastasis. It would typically metastasize to the pelvic bones, to the lumbar spine, the bones there, or the femur. And then swollen lymph nodes, of course, too, would be a late sign as well, a sign of metastasis. But lymph nodes is a common site of metastasis for prostate cancer because there's lots of lymph nodes in our groin, so close proximity to the patient's prostate. Sometimes they can have metastasis to the rectal area as well, again, because of close proximity. Diagnostics, then, what they likely do to diagnose prostate cancers, there's certain tests that they could do, like the PSA test, which we'll talk a little bit more about in class, but that's the prostate-specific antigen. So the blood test that they draw, and if that's elevated, it could be indicative of cancer, but not always. It could just be indicative of an enlarged prostate as well. And then the digital rectal exam, which you see in the top photo here, where a physician will examine the patient's prostate through the rectum to determine whether it's enlarged or they feel any sort of nodes or masses on the prostate. Ultrasounds are common in terms of diagnostic tests for prostate cancer as well. And then they'll likely do a biopsy, and the most common biopsy is what you see in the lower photo there, where it's rectally done. They could do one through a scope called a cystoscope, which would go up through the urethra and take a sample of the patient's prostate tissue that way as well. Treatment for prostate cancer, looking at non-surgical treatment, radiation is common, both external or internal, teletherapy or brachytherapy. Hormone therapy can be used as well because obviously prostate cancer is a hormone-specific cancer related to testosterone. So when you look at the medications, the leuprolide and the flutamide are both used to reduce the testosterone in the patient's body. So side effects that you could see with those medications would be things like decreased libido, gynecomastia, which is breast development in males, and those sorts of signs and symptoms. Hot flashes is another common sign and symptom with those medications. Megace then is used to help a lot of times with the unpleasant side effects like the hot flashes. And Megace can also be used in other cancer patients as an appetite booster if they have decreased appetite and they're having significant decrease in their caloric intake. And then last, you see on here in terms of non-surgical treatment that chemotherapy can be used as well. Treatment for prostate cancer, obviously we can remove the whole prostate, so that's a prostatectomy, and it can be done open or laparoscopically. If it's done open, meaning with one large incision, there could be an abdominal incision or there could be a perineal incision, which you see in the upper photo here. Side effects with prostatectomies are things like urinary incontinence or erectile dysfunction due to damaging of nerves near the prostate. An orchiectomy is also a possibility of a surgical treatment, but typically a palliative type of surgery. So an orchiectomy is removal of a testicle, and that's done just to decrease the amount of testosterone in a patient's body and to slow the spread of the cancer. So when we look at surgery for prostate cancer, pre-op considerations or things to think about would be, because of the close proximity to the rectum and colon region, they a lot of times do some sort of cleansing enema to clean their bowels out. And then in the operating room, they'll do removal of hair if necessary as well. And then, like we've said before, repeated a lot of that psychosocial anxiety reduction techniques and teaching about the post-op catheter that they'll have. Post-operatively, then we're worried about avoiding rectal procedures or treatments. So things like rectal temperatures, suppositories, enemas, just because of the inflammatory response that's in that area, and then avoiding straining with bowel movements. We know these patients will be on opioids for pain control, but if we can use stool softeners as well to decrease their straining that they have with bowel movements, that's helpful. And then they'll likely come back from surgery with a catheter, and it's normal to initially have the urine in their catheter be pink tinged. We're watching for clots. Sometimes they'll have irrigation to that catheter, which we'll talk more in our genitourinary unit about catheter irrigation. But in some cases, depending on the amount of inflammation that a patient has in that area post-op, the catheter may be in for several days, or they may go home with the catheter for a week or two. And to breast cancer, we'll talk about the assessments and treatments of breast cancer. So again, that breast cancer is the leading cancer in women in terms of incidence, and second with mortality. So assessment signs and symptoms that a patient with breast cancer may see are listed here. Lump or thickness in the breast, dimpling, that could be either of the nipple and or skin. And then with the dimpling of the nipple, you typically see nipple retraction, which you see in the lower left photo. Changes in skin can occur as well, the color and texture, and sometimes you hear it being termed as like an orange peel texture that a patient has over the area of a tumor in their breast. And nipple discharge is another sign and symptom, typically a late sign and symptom. If you look at the middle picture at the bottom here, the breast quadrants and breast cancer, you see that the majority of breast cancers happen in the upper outer quadrant, and that is typically because of the proximity to the lymph nodes that are in that area. So diagnostics to test for breast cancer, mammograms can be done. If there's an abnormality noted on a mammogram, they may move to an ultrasound next, and then the possibility of an MRI may happen as well. And then they can do biopsies, and you see a couple different types of biopsies or examples of them at the bottom. The needle biopsy, which we talked about, and then an excisional biopsy where they'd actually be able to remove the entire tumor with surgery and do a biopsy at that point. When we talked about other biopsies, we talked about an incisional biopsy, which kind of falls in the middle of those. And with that, they would remove just a small portion of the tumor and then do a biopsy that way. Typically, breast biopsies can be done via a needle biopsy, though. So treatment then of breast cancer, you see several choices here. Radiation, chemotherapy, targeted therapy can be done, and hormonal treatments. Tamoxifen is helpful for these patients, and we know breast cancer is an estrogen-sensitive cancer, so tamoxifen is an anti-estrogen type of medication. And so what we see tamoxifen used a lot for these patients is after they've gone through other treatments that they're on tamoxifen longer term, so maybe for a few years after treatment, and that's to prevent the recurrence of breast cancer in those patients. Surgery is another option for treatment of breast cancer, and we're going to look at the different types of surgery now. See a lumpectomy, and that's just removing the tumor and a small amount of surrounding margins of breast tissue. The right side, you see a segmental resection, and so that's essentially thinking of removing the entire quadrant that the mass is in. On the left, on this side, you see a simple mastectomy. A simple mastectomy is they're removing the breast and possibly a few lymph nodes. And then on the right, a radical mastectomy is where they're removing the entire breast, chest muscles that lie below the breast tissue, and then all of the nearby lymph nodes as well. When we talk about breast cancer, it's important to talk some about reconstructive surgery, because in these patients, that's a common choice that they have to make. And sometimes it can be done with the initial mastectomy surgery that they have. So they could have, as you see on the right, a breast reconstruction with an implant, and the other option on the left that's being commonly used is a breast reconstruction that's called a TRAM, T-R-A-M, flap reconstruction, and it's using the patient's own abdominal muscles, and they pull them up underneath and form a breast with those abdominal tissue and muscles. Surgery for breast cancer, things to think about preoperatively, again, emotional or psychological preparation, especially with the body image disturbance that can go along with a lot of these surgeries. And then talking to them about post-op cares, they'll likely go home with JP drains after a mastectomy. So post-operatively, you see lymphedema is a big issue. So lymphedema can occur in that initial post-op period fairly commonly because of the inflammation from the surgery, causing that backup of lymph drainage in the arm. Or it can happen years later, lymphedema can, because as scar tissue starts to develop around that area where surgery was done, then the arm can become swollen and have backup of lymph flow. So we say no blood pressure or needle sticks on the affected side, elevating the arm on a pillow, wearing a compression garment, which you see in the lower photo here. The compression garment in that photo is kind of deceiving. It's the flesh-colored compression garment on the patient's arm. And then mobility. A lot of times after surgery, they're not wanting to move their arm because it's uncomfortable or painful. There are exercises that we would teach them to do that don't strain the incision per se, but keep good flow in their arm and decrease their chance for lymphedema. So sometimes a patient has a bilateral mastectomy, and in that case then you sometimes do their blood pressures on their legs. Needle sticks and IVs of that sort can be placed in the patient's foot. It's important though, if you've had a patient who had a mastectomy, especially if it's been several years, to determine if they had lymph nodes removed on both sides. If they didn't have lymph nodes on one of the sides removed, you could, if necessary, do blood pressures or needle sticks on that side. Other things to think about post-operatively with these patients is they'll come back after a mastectomy and they'll have JP drains in place. And so we're doing a lot of teaching about JP drains on those patients, as well as pain control and positioning where they're lying with their operated side up to help with drainage as well. Nursing care, and I think we've pretty much touched on the majority of these things as well.